Today, more than 100 former NFL players filed a lawsuit in Atlanta claiming that pro football didn't do enough to protect its players from concussions. As more professional athletes come forward with life-altering injuries, our eyes inevitably turn to the athletes in our own homes. There's a growing epidemic across the U.S., young people getting hurt. The National Center for Sports Safety says more than 3.5 million kids under 14 receive medical treatment for sports injuries each year. Overuse injuries are responsible for half of all sports-related injuries in middle and high school students. Most injuries happen during practice. The rate and severity increase with age. Doctors here agree, saying too much of a good thing may not be good at all. KSFY's Courtney Collin explains.
Luke Kovaleski has been playing ball since he could remember. Now he's a starting pitcher for Roosevelt's junior varsity team. But the road to the pitcher's mound has been rough on his right arm.
I'd throw and then it'd just get all inflamed and started hurting about right here. And just couldn't throw anymore, so I had to stop.
He started suffering from an overuse injury. It's something Avera orthopedic surgeon Dr. Eric Peterson says is fairly common among little leaguers and teens. Luke sees Dr. Peterson for his elbow.
In Luke's case, we think it's that he came in, he started throwing hard right away, so he's probably throwing too much, too hard, and his mechanics weren't fine-tuned.
And Dr. Peterson says that's the fast-growing epidemic among young people who come to see him. Starting younger and playing harder can very well lead to more injuries.
Since my injury, it's been really important for me. So after I pitch, I ice a lot and go running because that helps get rid of all the acid in your arm. And then I usually don't throw baseball for 2 or 3 days because I just need to rest it up.
Rest and also stretching.
He just told me to stretch before every game and before I throw and get really loose, and then he gave me this band that I tie up to a pole and do a bunch of pull exercises and over my head and just to loosen it up.
Even his mom, Danita, is there to monitor it all.
As a parent, I take that very seriously when they do get injured, that they need to see the doctor, that they need to follow the protocol that's set before them. And if it hurts too bad, they can't play because it could become a lifelong injury that, could cause them to not be able to do what they want to do when they grow up.
And those lifelong injuries are what doctors worry about. Anything from stress fractures, concussions, to ligament tears in the knees. Avera pediatrician Dr. Sam Schimmelfennig says there's a risk involved with pushing kids too young.
Kids are doing a lot of growing. The growth plates are the weaker points in the bones, and those are more prone to injuries.
While most kids just like getting out there, Dr. Sam says often it's the parents who need to step back. He spots a red flag when kids make vague complaints. It could be overuse or kids are just burnt out.
A lot of times it's easier to get out of a sport because you have an injury as opposed to just saying, I'm just tired of doing this. And so especially older kids, you start to get these vague complaints of the knee or the arm, for example. And a lot of times that's just that they've done it so long that they're tired of it, but they don't really want to admit to anybody else they're tired of doing it.
Luke loves the sport and will do everything he can to take care of himself to play through the fall, following through with doctor's orders so he can stay on the mound. Doctors want kids to be active and involved, but above all, safety for tomorrow is most important. In Sioux Falls, Courtney Collin, KSFY News.
Now a sophomore, Luke hopes to continue playing through his senior year. He dreams of becoming a doctor someday, and he plans to study pre-med while playing baseball in college. Here's some helpful tips for you and your young athletes. Listen to your kids. If they complain of muscle or joint pain, you should take it seriously and let them rest. If it becomes a pattern, see your doctor. And as always, moderation is key.